Recording in progress.
Arch Project has collaboratively worked together with ASEAN member states to build effective mechanisms to enhance disaster health management capacity in the region. Indonesia, as host country of ASEAN Institute for Disaster Health Management, organized academic activities to strengthen capacities of disaster health-related personnel, such as curriculum development, trainings, and simulation exercises, conduct consultations in disaster health management activities, facilitate, provide policy guidance, and support the organization of regional collaboration drills on disaster health management in AMS, support the ASEAN Academic Network on Disaster Health Management, AANDHM, including the steering committee in the execution of its establishment of a regional network of training centers of ASEAN member states that implement general and specialized learning, education, and/or research programs on disaster health management.
To contain knowledge management basis in disaster frame, which is one of the ASEAN Academic Network on DHM activities, by establishing the ASEAN Journal Disaster Health Management or AJDHM. ASEAN Journal of Disaster Health Management is a scholarly publication that is dedicated to advancing the scientific knowledge of disaster health management from the ASEAN and non-ASEAN regions. Facilitated by the ASEAN Institute for Disaster Health Management, the journal serves as a scientific platform for researchers, medical practitioners, decision makers, as well as scientists who are interested in DHM. AJDHM was established to provide opportunities for young medical practitioners and all healthcare providers in relevant fields on DHM, and researchers who may be inexperienced in writing English papers from ASEAN and non-ASEAN regions. Platform to publicize case studies of actual DHM practices in the ASEAN region, DHM domains of regional research, capacity development and policy recommendations, and collaboration between health sectors and other sectors in disasters. Health emergency and disaster risk management framework in ASEAN. Review articles for world-class and high-quality articles on DHM should be published proactively. Submit your article and contribute to scientific ways for positive impact to the ASEAN and global beyond.
Apologies, you're still muted.
Be your moderator for today.
We are so thrilled to have you join us for this important discussion where we are going to delve into the essential components of crafting compelling introductions and robust method sections in research paper, especially on disaster health management. So today, we will have a brief lecture from our distinguished speaker, then continue with the interactive session where our speaker will guide us through the real example of introduction and methodology in the research paper, and continue with the question and answer session. So if you have any question during the presentation, you may type your question in the chat box or feel free to put the raise hand option in Zoom to ask directly to our speaker during the question and answer session. So it is my pleasure to introduce our distinguished speaker, Dr. Tiara Martias, and let's watch her brief curriculum vitae. Okay, hello, Dr. Tiara.
Hello. Good afternoon.
Okay, so Dr. Tiara, it's very nice to meet you today. Thank you for your willingness to share your expertise today. So I think you may start your presentation.
So thank you. Can you hear me all right?
Yes, probably.
Okay, good. Hello everyone. One thing though, I still can hear my voice again in the background. Is there any way to
It's okay.
can I
Yes, we can
do-
hear you clearly.
Right. So thank you and welcome everyone to the session, and thank you for the participation. For this, I won't say it's a lecture. It would say a bit of sharing an experience and telling my experience in writing introduction methods, and probably we can also discuss together on the important stuff and also the challenges that people might find compelling in writing a journal. And my it is very echoey. I also can hear my voice,
Apologies, everyone.
again,
So
which is
I think
kind of
we
distracting.
have
Sorry.
some kind of technical problem. So let our technical team to resolve. Okay, Dr. Tiara, you may continue.
Hello. Yes. Can everyone hear me okay? Good. Now I don't hear my voice again, which is good. Can I just check with the participants whether it's still echoing or not? Good. Okay. Abraham, thank you. Hafizati, thank you. All right. So I don't want to be too formal in this session, but so I'm happy if anyone would want to raise their hands if anything's unclear, or I'm speaking too fast or too slowly, and if there's anything you just want to ask, we do have 1 hour and 45 minutes. If I'm not mistaken, to just like go through the introduction and methods and a bit on the referencing. So I'm also aware of, there are so many different backgrounds, I'm sure, in the room today. So I apologize if this is too basic for you all, and it might not be at the appropriate level. But I try to find the balance in terms of it's an introduction, but also we can discuss further in a more comprehensive way if that's what is needed for participants in the room. Just wanted to go to the second slides on what we are going to talk about today. Oh, sorry, just a bit of myself. I'm from Indonesia. Before, becoming a researcher lecturer at the Melbourne University, I was at Gajah Mada University. So I worked mostly in global health, maternal and child health, not really much in disaster health management. So my apologies if my understanding on that particular topic might not as advanced. But I hope in a generic sense, the intro methods for a research paper can be applicable to all topics that of your interest. Next. Right. So three main points that I just wanted to share today. So the first is what makes a good introduction in a research paper, and then how you would go about choosing or designing methodology, and then finally using references appropriately. And I'm going to touch a bit about plagiarism. Just bear in mind, these are not the most comprehensive because I try to kind of provide a general overview, but also applicable skills in the next 1 hour or so. Next. And I'm sure a lot of us have published papers, some maybe more than the others, but I just wanted to touch base on the principle of writing introduction based on research context. And I also slip in some examples that we can interactively talk about together throughout the presentation. And I hope I'll get your feedback as well on how you would think this introduction works for you or doesn't work for you, or if you have seen something better published in other journals. So what is research context? Next slide, please. So it's really important to set where your research takes place. So what's the environment? What's the setting? Is it a national level? Is it a global level? Is it a local level? And then the research context should be put in place within the introduction so that you can provide more background and give the audience or the readers of your journals, and of course the editors who's going to process your peer review, for example, what's the meaning of your research in terms of its significance in a wider perspective. And then of course you have to sell why the study is relevant and necessary, right? So I'm sure there will be sessions as well on publication. The first thing that the editors of a journal gonna look about is your cover letter, which would include a lot of the introduction, your summary of findings, and then the significance of your study. And then the next thing is the introduction, because the introduction is the hook where you get the audience to keep reading your paper, and where you get the editor to find your research paper is worthy to be published, right? So you have to provide the context. And in the next slide, yeah. So aside from the background and rationale from the study, which we're gonna look some examples on, it helps to frame the research question as well. So usually at the end of an introduction in a research paper, a research question is posed, or a research hypothesis is posed. And then you go back again to why this research question is worthy to be answered, and why people needs to keep on reading our paper, because it's relevant and it has a greater meaning or a greater benefit, not just to the small context in which the research takes place, right? And then in the next slide, so first, in order to write a clear research or a paper introduction, you do have to provide a bit of a background information on the topic, on the issue. For example, you're writing about, natural disaster and management of or mitigation of the impact of the natural disaster. Why is it important? For example, in the global context, how often does it happen? That makes it, super duper important to be researched. And then you have to also kind of summarize the literature that have been, going about, to show that I know people have researched A, B, C, and D, but then they haven't researched, X, Y, and Z, which is the gaps in existing research. So you do have to say that I know what's out there, but some things are still, relevant to be answered through a research, or some things are still left unknown. So I'm trying to fill that gap. And as in any other research, and I'm sure a lot of you would have, known about this. What we try to build when we try to publish is not totally, something super duper new, but instead we build upon the existing research. And then the existing research would have research gaps. And that's what we're trying to fill. And that's how knowledge is, basically developed as well, right? So people would research this, but they haven't really looked at a certain angle, or they haven't, assessed a certain aspects of, for example, the preparedness of mitigation for natural disaster in a particular setting, in an urban setting or rural setting or a health facility setting, for example. And then you go back to the societal, scientific, and practical relevance. So first, again, you should provide a general, like a background information on the topic itself in a broad, in a broad sense of view. So at the global level, for example, tsunamis happen every whatever, and then it affected not only the population that directly impacted, but also, indirect impacts, economic, non-economic, psychological, and other stuff, right? And then you summarize the issue as well. So, but in terms of the readiness in the mitigation of some natural disaster, a lot of, for example, rural health facilities aren't equipped or aren't fully equipped. There have been, for example, and then what's the stated knowledge or practice? There have been some guidelines on A, B, C, and D. However, in this particular region, in my area, or this particular region in ASEAN, for example, there haven't, been a fully comprehensive assessment on what the readiness level is in terms of, for example, rural health facility readiness for natural disaster. And that's the gaps. And then you would go about again. So if we are able to assess the gaps, then we know what kind of investment needed in which places that needs to be prioritized, for example. So that's the thing that you have to have in a good introduction. And next slide. So this is just one of the articles that I come across. So it's not a particularly, I don't think this is a very, we call it famous journal, or maybe it is, right? But it's pretty good. So it's a critical care resources, disaster preparedness, and sepsis management, quite specific. It's a survey results from the Asia Pacific region. And if you click once, then I just took a screenshot of the introduction. So it gives the background of, the COVID-19 pandemic, and then that the rapid healthcare, mobilization would have overcrowded the health facilities, and some essential services are actually left behind. And in this sense, it's the focus is on the ICU. So, but what I want to show is how they then kind of formulate the gap in the research practice or the knowledge. If you click once more. And this is like most explicitly how you would identify the gaps in existing research. So currently there's limited data about resources, whatever, after they're kind of 2 paragraph long of literature review, summarizing, what's the situation, what has been done, and then they go about, okay, but here's the gap, and this is what we're interested in. So it's a good segue and also quite explicitly saying, okay, this is the gap and this is what we are going to answer. Because in the in the last sentence then, thus we conducted the survey to map A, B, C, and D, right? So that's how one way to say about the gap after, if you click before, sorry, can you click backwards? Yeah, this one. So the first paragraph is saying about the background information, what's the issue that they're going to analyze, right? And then they give a bit about the literature review summary, what happened, and then what have the World Health Organization done, and then and all that, and then they go about the gaps. So that's some of the key elements that this particular introduction have. After a couple more slides, we are going to see a bit more of another paper on disaster that I thought we could work on together. Okay, next slide. Right. So how do we go about identifying the research context? Of course, you would have to read a lot. Conducting a thorough literature review not only would give you, knowledge on what's going on, but also what's the current debate. So what's the hot issue or the issues that people are still not sure about, but also to identify, the trends in the field, right? And whether you want to follow the trends or do you want to fill other gaps, that's also another choice to make. But there's an importance to understand what have been done historically and the current state of the research area. So what kind of framework is being used now, what kind of guideline is now the kind of the gold standard. And yeah, so if you, for example, cited something older than the WHO guideline in 2017, for example, that might not be relevant anymore. And most of the more recent research have been using updated framework, for example. And then also the context, right? In that previous paper, people have been citing COVID-19 as COVID-19 have shown, the health system challenges, the existing health system challenges that show that no, we're not ready for any health crisis, disaster or non-disaster, but the pandemic have really shown that most countries, including ASEAN countries, are not prepared to handle a large-scale health disaster, and that's why that's the context in which we operate. So COVID-19 have shown us this, and then we're gonna proceed to assess a different side of things that also talks to the context, but it's a research gap that we're trying to fill in. Next one. So there's this thing about inverted pyramid in terms of writing introduction, and this applies as well for essay writing, a bit different for for example, popular publications such as newspaper article and stuff. But the general idea is at the beginning of your essay, your introduction, it's the attention grabber, right? So in the first few sentences, like the first 2 or 3 sentences of your introduction, you have to hook or reel in the readers by saying something. Oh yeah, this is a real problem that are contextual and also relatable to a lot of people. So for example, if I want to research about Indonesia, I wouldn't start with Indonesia per se, right? For example, I'm a health financing researcher. So I do, analysis on health insurance, for example. I'm not gonna talk about Indonesia in my first sentence, but rather I want to attract attract attention globally. So I would say universal health coverage globally is a huge agenda, right? And then I can also say a lot of countries. Then I move on to low and middle income countries or countries in ASEAN, for example. Countries in low and middle income countries or countries in ASEAN have struggled to find a way on financing their health insurance system, for example. And then I go to um, Indonesia context in more specifically, right? But the first two, three sentences is the attention grabber. So start with a broad overview, and then you narrow down to specific research problem. Okay, and then you give a bit of background, and then you go more specifically into your context, your study sites, your population focus, or whatever you're researching. And then at the end of your introduction, it becomes even more narrow by stating the thesis or your hypothesis. So this is what we are gonna do. This is what we are asking, and this is what we are addressing, particularly in this specifically in this study. So again, it's an inverted pyramid. Start broad, and then go narrow, and then go to your research question or your thesis statement. I know we're not talking about the discussion in this session, but I just wanted to know as well why we use inverted pyramid in the introduction, because we use the normal pyramid in the discussion section. So for journals, for academic writing and everything. So you flip that around for the discussion session, where you start with the specific findings of your research, and then you go broader to how it's relevant to a larger context. How is it relevant to not just Indonesia, for example, but how is it relevant to other low and middle income countries with similar contexts? How is it relevant to maybe other middle income countries in Africa and in other regions as well, and even probably high income countries which are which might be thinking about refinancing their health insurance system. For example, the US isn't doing well because their health insurance is a bit crappy and they might want to reconsider different approaches to the model of financing, for example. And to go to a bit on the disaster management side. So, for example, I just wanted to assess my primary healthcare center's readiness or my local hospital readiness on disaster management, for example, right? And I have this data, I have this framework, and then I have this benchmark that I have in mind to go about that. But I'm not going to talk about that particular hospital right at the beginning of the introduction. I'm going to show the readers this is a relatable issue, even if you're not living in the hospital or not working in the hospital, right? Because whatever this hospital's problem is with disaster management can be applicable to a broader context, right? So that's how you kind of reel in readers. It's not just selling, but also giving that this is contextual, this is relatable, and the generalization is there to other settings with similar context. Next. I just wanted to put this slide because I think good research is the one, with a good research question, with a question that is worthy to answer, really. So it doesn't matter how fancy the methods used are, but if the research question, you kind of know the answer already, then it's not really a good research question. A lot of people would just want to publish by asking questions that, what is the determinants of, for example, healthcare seeking behavior? we kind of know that, but we can still publish, but it's not an entirely novel, it's not entirely, new and exciting paper to read, right? And I'm not saying that I haven't done that before. Of course, we have to be strategic in our publication as well, and which is another topic to cover. Honest. But yeah, try to tease out a good research question that is worthy to answer, and then put it in your context. Write it well in your introduction. Yeah, next. And if anyone has any comments, or question or clarification, please feel free to pop it in the chat box. So we're going to an example of what kind of a good introduction that is well contextualized looked like. The next slide gonna show you a paper from BMJ Global. Next slide. Yeah. So it's a systematic analysis on patient safety practices of emergency medical teams in disaster zones. It is a systematic analysis, but BMJ Global Health is a really good journal. They're really going up the ranks in recent year. The editor is really good, and they do publish a lot of novel novel practices, novel findings, and also novel methods. So I like the journal as well. And then in this particular paper, next. I want you to identify, which one is the background of the global statement, which one part of a kind of literature review, the current state of knowledge and practice, gaps in the existing research, and then the relevance of the paper. So I'm gonna kind of open it to the floor, and I'm gonna show you, the next two slides. Gonna be like the different parts of just the introduction of that paper, which you can read for a bit, and then decide where did they put the background information, current state of knowledge or practice, the gaps, and also the relevance. Next slide. I just wanted to remind you again. So the inverted pyramid is start global and then go narrower down to your specific research question, right? So this first bit of the paper from the BMJ Global Health, what do you think this one kind of provides? Which bit of the introduction it contains? I'm happy for people to just open their mic or put it in the chat box, or you can ask as well. You don't have to answer directly. Okay, so maybe let's make this as a multiple choice question, right? So is it the background? Is it the literature review? Is it a bit of both? Is it current state of knowledge or practice? Is it the gaps, or is it the relevance, societal, scientific, or practical relevance of the paper? No takes?
Can I answer the question? All right.
Yeah, sure.
Okay, I think someone has already write on the chat box, and I think the same way of him.
Yep. It is the literature review. And also, I just wanted to add, can you click once? It's also a global statement of the topic, right? If you see the first sentence, natural and man-made disasters represent a significant global health burden, particularly in low-income countries, low and middle-income countries, right? So that's the attention grabber as well. It's a global statement, and then they proceed to, some of the literature review, but not really in this. It's more of a global statement on what is the big problem here, right? And then if you can go to the next slide. I tried to kind of divide the different bits of the introduction as well. So the top one here is also a bit of the literature review, right? What about the second bit? So the incidence of patient harm in the UK was thought to be 10%, and then specifically within disaster zones, predominantly in LMIC. Or what do you think that one is? It is a literature review, but maybe more specifically, why is it there? If you click once, can you click this once? It's part of the literature review, but at the end, it's important because there's a lot of huge burden on hospitalized patients, and also dominantly in LMIC. There's even less data on patient safety outcomes, which means it might be a bigger problem than it is. And then the next bit is saying, can you click once? What has been done, right? So this is a bit where it kind of show the current state of knowledge or practice. So the WHO launched global EMT initiative, and then registered EMT are then deployed and coordinated by the host government to ensure quality of care. So, and then the top part on the right-hand side, that would be, any thoughts? While guidelines have been available for many years, they provide generic pre-hospital and hospital. And then look at the last sentence of that long paragraph. The validity of HIC non-disaster patient safety practices in an LMIC setting has not been established and warrants further study. So any thoughts on what that might be? Current state of knowledge and practice, a bit of that, yes. And yes, and that would be the gap, right? Thank you, Hafizatu. Right, so they say, okay, we know this and this and this, it's an important issue, but we haven't known about this particular bit, right? And then it goes to, that small bit there, which is the research question, right? After it says about gaps, can you click twice? Yeah, so this is what the study is trying to answer. So the research gaps, and then they present it. We know this, and then these are the gaps. So we're gonna focus on this. The aim of this paper is to identify the pattern of patient safety practices of EMTs in LMIC disaster zone. And then they go about to the last bit of that by saying, by identifying where patient safety practices can be improved, it may be possible to enhance organizational, cultural, clinical, and medical report outcomes in disaster zone medical relief. That would be, click once, the relevance. Okay, so these are the things that they put in their, introduction. Is there any thought about you can make it better? Is it too long? Is it too short? Is it way too specific? Or any thoughts at all? Not yet? Okay. I think it's pretty good. It even for a non-disaster management or disaster, research background, I kind of know. Oh, okay, patient safety issue is important, of course, in where disasters happen, right? And then, but are we ready to ensure quality? And what do they have in ensuring quality? Oh, apparently they have this registry, whatever, and then it kind of have a good segue in terms of okay, HIC or the high income countries have this, but it's not really sure how its implementation has been in the low middle income countries. So they're gonna do literature review to see what's people have been talking about, what have what have they found in terms of this research and how it is applicable to low and middle income countries. And yeah, next. I just wanted to show that for some papers, some journals, they have this specific section that they include, up front in the first page, on the first page of the publication. It's not just BMJ Global Health. I think some of the think Lancet have it, has it, or plus one, plus something. So the authors are asked to summarize upfront what is already known, right? What new findings their paper offering, and then how do the new findings imply? And these are basically why we write, why we do analysis, why we try to publish, right? So we know the gaps, we offer new findings, we offer new insights, or we even offer new similar assessment but from a different angle, from a different context or different setting. And then we go about generalizing or trying to interpret the findings in a more meaningful way for other people as well outside of our context, right? So I'm not sure if our ASEAN journal are intending to do this, but I thought it's a good practice and it helps the author, but also it helps the reader, but also actually the authors to really think how to frame their research paper in this way, right? So it makes it more relevant, more relatable, and then clear in terms of how it's meant to be interpreted for others to find it helpful, right? I'm just gonna pause a bit because I'm gonna go into. Oh, not yet. Okay, next slide, please. And just some tips on mistakes to avoid when we're writing the introduction. So sometimes we go too broad, a bit too broad or too narrow in the introduction. You gotta have that balance in terms of providing a good local, regional or global context to hook people in. But also it cannot be way too broad that it's not relevant or it's too far away from what you're researching, and then overloading people with unnecessary details, making the introduction a bit too long. Some journals would expect a long literature review section. For example, social science and medicine are notoriously keen to have a long literature review section because they think that would capture the essence of existing research and also strengthen the rationale and justification for that paper. But most journals nowadays, they have quite a simple but catchy introduction, I would say, and not too many details except the ones relevant, to reel people in and also to bring or give segue to what the paper is about. And then the last pitfalls is failing to connect the context and the research question, right? And I'm sure a lot of you would have seen this in other papers, but sometimes we talk about, for example, we talk about disaster, tsunami, and all that, and then kind of out of nowhere, we wanted to research about something a bit not too relevant or not, well connected to tsunami or other disasters. For example, you talk about tsunami and then you said, "Oh, I'm gonna research about nuclear hazard," for example, in Aceh, just because a tsunami happened once in Aceh or happens multiple times in Aceh. Sorry, and it's not the right segue to connect the context and the research question. Next. So a bit to end on just the introduction bit, yeah. So keep it relevant, concise, make it clear, make it focused, and then make sure all the paragraphs are coherent and talk to each other. And then always link back to what your research topic, what your research question is about. So that's all that you write in the introduction is actually to convince people that your research question is valid and worth to be answered and worth to be read by the editors, the journals, and then the audience of your paper as well. And then if you have any questions or anything to clarify in the introduction section, you can also share, for example, if you have had challenges in writing an introduction or what kind of challenges that you have encountered so far. I'm just gonna wait until people, nope. I'm just gonna wait until either people put their thoughts in the chat or raise their hands by saying that a lot of my papers that I've published with colleagues, the introduction bit is the hardest bit to be written, honestly, because it's really difficult that I find it's quite difficult to write a catchy one without going too long or providing too many details or data, because we thought everything is important, or because I thought everything is important, right? And then usually we leave the writing the introduction at the end of actually drafting the manuscript. So the easiest part would be the methods, because we know what data we have, because we have the data usually before writing the manuscript, right? So the methods would be an easy bit. The results section would be an easy bit. And then the discussion section would be a bit harder to write as well. And people who know about policy, who know about, real life setting, would be the best writer, I would say, for discussion section. And then when everything has taken up shape, and then I go to the introduction section and then draft that one. Maybe it's not the best practice, but I find it helps because we know what we're trying to get, the message out there, having written the methods, results, and discussion section, and then we can shape a bit more concisely the introduction bit. A lot of people would do it quite differently as well, but I find it's a common practice apparently to write the introduction at the later stage of the research. So I'm still waiting for if anyone have thoughts to share, or sharing your experience as well in drafting an introduction of a paper.
So maybe one could share your experience on writing the introduction.
Sorry, Sorry, I can't really hear you.
Okay, Dr. Tiara, sorry for the still echoing. Oh no. Okay, thank you.
Okay.
Okay, Dr. Tiara. I
There's
think
one in the
some
chat.
comment from the audience.
There's one comment. Yeah, there's one comment in the chat. Yeah, so I spent a lot of time to start writing introduction. Biggest challenge is starting the first sentence because I always doubt it will be good hook or not. Ah, yes. So I have two thoughts about this that I wanted to share with you all. One, this is why I put it in the last bit, right? Because if we don't start, we're just gonna delay the writing of the paper. So start with the easiest bit of the paper that you can write actually. So the methods for me is straightforward because we know our data, we know the type of analysis we have done, and then the results would follow the methods quite easily. And then you kind of sometimes I like to be in between, oh, after writing the methods and results, I kind of know what I wanted to put in the introduction sometimes because I know the interesting findings, the things that I would want to highlight from the results, and then I put it in the bullet points for my introductions section. Don't worry too much if the starting sentence, gonna be a good hook or not. I would put it in bullet points and then just start from there. The other bit is also you kind of know the findings could be relevant for the broader context, right? And then after knowing that, I think it kind of helps writing parts of the introduction a bit better as well. But I do have the same challenge with Abdul Hakim here. That's why I try to put on hold the introduction as much as I could. And because it's just gonna delay the paper being written, and it doesn't matter how good of an analysis or data that you have, but if you don't publish it quite timely in terms of like the data is not already outdated, it's not really worthy doing the research because you cannot disseminate. You might be able to disseminate in other forms, but having a manuscript, it's a totally different audience as well, right? And it's gonna be available to be cited. People can read it instead of, I think what we do a lot is also we make policy briefs. We do dissemination meetings on our research, but those are one-time thing. They don't last forever. But journal article, they're there as a repository where people can use them, revisit them, and then cite them properly. And then it's gonna be there for other people to benefit from. Thank you for the comment, Abdul Hakim.
Write their questions or sharing their experience. I have a question for you as well regarding the introduction session. So in the disaster health management, usually there are already a lot of things that already been done or already become a policy, but unfortunately we still sometimes lack of research or scientific background. So sometimes it's difficult to find the gap on writing literature, but it's already become common knowledge, but not in scientific literature. So how we adjust for on writing the gaps or the current situation if there are some common knowledge, which probably if in the international context it's not that common, something like that. Thank you.
Yeah, and also that relates. Thank you for the question. it also relates that the disaster, management topic is quite niche and also quite new as well, particularly in low and middle income country, and not just in low and middle income country, but in high income country. They also, I think it's quite new as well and quite novel. Oh, sorry, I'm still hearing feedback on my voice. My yeah. Okay. Hello, testing. Okay, thank you. Oh no, still hearing it. Is there any way to mute like the speaker over there?
Okay, probably you may continue now.
That's 1 2 3. Yeah, okay, that's better. And for the audience, please let us know if you're still hearing echoes or anything. I still hear my voice. It's kind of disrupting. Sorry, it's difficult to concentrate.
Okay. Okay, sir. For the technical team, probably can resolve the problem.
It's like having a hallucination, hearing your
How is
voice
it
in your head.
now?
Yeah,
Still
it's better.
echoing?
Thank you. No, that's better. Thank you. Yeah. So I think a lot of people would say anecdotally, like anecdotal evidence, and also we don't always have. If it's not there, it's not there, right? But if you can cite any news publication or any popular publication that cites, maybe not entirely, data, but a factual observation, right? That could still be valuable as well. And this is also how knowledge kind of develops from something that is intriguing for us to things that we can actually prove, can feel and touch and kind of quantify, kind of document, or, in terms of even qualitative data, including, right? If we can put it on paper and then it's there and then people can cite. But when it's not there, it started off with this curiosity and things like you said, people know it's a common knowledge, but it's not really documented. You can also cite like um, popular like blogs and all that to also capture the, I think, the issues that are playing at hand. Yeah.
Even though it's not that scientific, probably, if we find some written on the internet, even though it's blocked, but it can support our curiosity, probably we can use that.
Yeah, and also I think even lately a lot of the academic publication, it kind of spill over with a more popular publication as well, right? For example, I know people have started research based on the news we get, online. So what are the headlines? For example, it started off during COVID. A lot of women in various countries in ASEAN are being neglected or rejected from them at a hospital because of the fear of COVID, especially in the first few weeks of the pandemic, right? The first people who caught this kind of phenomenon are not academics, for sure. Those are the journalists, right? But then we start off with those headlines. So women in hospital A or primary healthcare, whatever, being rejected, and then they had to deliver at home. And then you cite that's a phenomenon that is happening because these are the headlines of many news outlets. And then we're gonna research what are the factors that actually contributing to this. Why aren't the health worker understand enough that there are mitigation plans and actions that can take to prevent infection and all of that, right? So there are a lot especially during COVID, because data aren't always available, but news are always available, and then there are a bit more spillover between the academic side and the popular kind of news channel. So that's also, I think we should be quite open-minded, not just something that we can cite, but yeah, like you said, knowledge is what we see and how we interpret things.
Okay, thank you very much, Dr. Tiara. It's very insightful. Yes.
Thank you. There's another question in the chat box from Senna. Biggest challenge is in opening introduction. How to grab globally info and also engage the readers to know what info in specific country is. Should we only discuss the global data in the first paragraph? This is very interesting. We don't always have to discuss global data in the first paragraph, but we mentioned that this is relevant for a global issue, for example, or regional issue, right? Or even national issue. We don't always have to throw in, the pandemic preparedness index, and globally, according to the global, health security index, for example, it's this, when we only want actually to focus it on Indonesia or Myanmar or Philippines or any other countries, or a particular region, like it's just Asia Pacific, or it's just Southeast Asia, for example, right? But you do need to have that hook. This is not just relevant for this small context of a research, but this is relevant for other contexts that might be similar or have some similarities to what I'm researching at. So that's the opening of the introduction, is giving, that, I think, a shared concern, not just, among people that is close to us, people across countries, across regions, but, a lot of our issues, in disaster health management, and maternal health, and child health, and infectious disease, and non-communicable disease, they're all intertwined with each other. Especially after COVID-19, we realize that we're also connected across the globe, and especially in our region. That's it's what we have as a challenge might also be relevant to other settings as well. So you can kind of reel into that particular interest. I hope that's helpful, Senna.
Okay, Dr. Tiara.
Yes.
I think there are. This one is already from Ajeng Rahastri.
Yeah.
It's already
Ajeng.
answered.
Some papers stated very short introduction without comprehensive elaboration, or without. It's not really usual, I find, especially in public health and global health, because it's I understand and I think I know what you're talking about. Some of it are just a short 2 paragraph or even one, but the introduction, I find, again, and as I said before in the presentation, it really helps contextualizing the findings later on, and it really helps to make people see how this is an important piece of paper or a piece of research that might be not just relevant in this particular barangay, for example, or kampung, right? But it's relevant to other rural settings, for example. It's getting shorter and shorter, probably, possibly, because the overall research paper is, I think, now getting shorter. A lot of the research paper, like 10 years ago, would allow 5 to 6,000 or no limits to the word count. Now it's almost always like 3,500 to 5,000. Even the 5,000 ones are quite rare. I think also because we're competing with a lot of other publications, and a lot of other good studies are coming out. So I think it's not just the introduction that is short, it's the kind of the whole paper as well. I hope that helps, Ajeng. Senna is asking a follow-up question. Would we say that we use global data as relevance context so everyone can relate? Yes, if only it's applicable. Senna. So we can, there are specific things I think that won't be relevant as a globally, but it might be relevant nationally or regionally, right? So try to see the bigger picture, or only when it's applicable. Yeah, that's what I would say on that.
Before we continue, probably I would like to remind everyone that we'd like you to fill out the attendance form for today's meeting. And also, if you still have any question, please type down in the chat box again, or just raise hand to speak directly to Dr. Tiara. And Dr. Tiara, do you have any other materials to cover in probably the research method for your presentation?
Yes.
Or we
Yes.
still continue?
I do still have a lot of slides. We can continue with the
Okay.
methods.
Okay.
Cool. So in the next slide, and few after that, we're gonna talk about choosing a methodology. And I'm not trying to go into like super deep because I don't think we have the time nor that it's appropriate session, but it's more as a general kind of thinking and the pitfalls as well when people choosing methods for the paper, right? Next slide. And I'm sure a lot of us would have known this, but it's a methodology section of a research paper. It's quite specific to what procedures did we use to collect data, to analyze data. Does it follow specific scientific procedures? I'm more of a quantitative researcher. So is there any particular statistical package that I use, or statistical methods or approaches that I use? So in the method section, it has to be clear that each of the steps that you do from when you preparing to collect data, actually collecting the data, what you did with the data, how you go about analyzing it. And again, this is sometimes a lot of papers don't do this, but when we write a methodology, it should be replicable, right? It should be as clear as when other people read our method section, they can do it as well. They can replicate what we did. That's one, it's an accountability form. So we don't just say, okay, just trust us, we did this, you just have to trust us with our analysis. No, that does not make a good paper. You have, as an author, you have to convince people, you have to convince your editor, you have to convince your reader that you actually follow, a scientific process. When you have the data, you collect the data to where you get to the findings and how you interpret the findings. So that's a rigorous method should look like. Again, it has to be clear from A to Z, but also it has to be as clear that people who read it could replicate your steps, right? And as a growing community of scientific or education and whatever, academic, really, what we want is to share our knowledge as much as possible. And this is why a lot of journals now, for example, they would ask authors to also include, for example, their statistical analysis so that people can read their code, for example, if they're using Stata or R or SPSS or whatever. And for the qualitative bit, for example, they would say, please upload as well your interview guides. So it's super transparent. People can learn from it. And the more recent one, I think, is data sharing. So if you're using data that can be publicly available, you also upload that as part of your manuscript. So people can also manipulate the data, they can use it, they can reanalyze it, they can point out, oh no, actually you did something wrong, because it doesn't mean that once the paper out there, it's always correct, right? People make mistakes, we're all humans, and some people make, mistakes knowingly, for example. So it's a chance for the scientific community to critique one another, in a sense that we want to critique people so that we have the best knowledge out there, and not just some crappy paper where people can cite, but it's not really adding much, value to mankind, to be dramatic. Okay, next slide. This is also, well, it might be more relevant when I speak to my students, and I know a lot of you are quite a seasoned researcher, so I apologize for the level of discussion. A lot of people actually start the research or publication or whatever with the methodology instead of the research question. So always start with the research question, not the methods, because the methods is just a tool to answer the research question. It is almost as if like, okay, I want to cut down a tree, or I want to dig a grave, right? I want to bury something. So do I use an axe or do I use a shovel, right? It does. You don't decide, oh, I want to use a shovel. No, you start with whether I want to cut a tree or whether I want to bury something, so I need a shovel. So that's the research question. So start with the research question, and then the methods should follow suit, in terms of what methods is more suitable, is more appropriate, and more feasible to answer that research question. So this is a lot of mistakes, maybe not mistakes, maybe also being pragmatic or practical with saying, oh, I just want to do a qualitative thesis, or I just want to do a quantitative example, right? But what you really supposed to be asking is, what do I want to study? What research question do I have burning in my mind that I want to research about it? So that's the go about, in general, not just a methodology, but also kind of approach to why we do what we do, why we study what we study. Yeah, next. So why is it important to choose appropriate method? And also, again, I'm sure you already know this, but a lot of people, sometimes we write the methods unclear enough, not clear enough, and then whether maybe it's not a reliable method, or it's not suitable to answer the research question. So unreliable method would lead to unreliable results, right? And then if you choose incorrectly and there's a misalignment between the research question and the methodology, and then people would question your all findings, right? You're asking about this, but why are you using quantitative data? You're not gonna get the how or the why if you're just using quantitative analysis, for example. And so your interpretation of it, the significance of the paper, and also the relatability of the paper becomes questionable, right? And then next. In general, and I'm sure you know this as well, there's a quant, there's a qual, there's a mixed method. I don't know exactly where to categorize, all the literature reviews, because we can have meta-analysis, which is kind of quant, but also scoping review and systematic literature review. It's not really quant, but it's not really qual. So let's just make it a category of document review, right? The quantitative research in the next slide. Usually it's just straightforward. So you collect numerical data, it's all numbers. You have usually a standardized research tools, even it's a survey or a database that you access, and then usually the methods are repeatable. And then sometimes you can predict outcomes. You can present it in really nice graphs, tables, figures, but also it's usually close-ended questions, right? It's not the why, it's not the how. It's usually the association or causal kind of inferences that you can get for a quantitative analysis. And then the research designs, and that also depends, right? Whether you want to be descriptive, you want to be causalistic, or you want to be experimental. So you can do some experiments if well, we rarely do something experimental unless you do something quite clinical or biomedical stuff. We often do correlational analysis with quantitative data that we have, or quasi-experimental. So quasi-experimental is also trying to figure out the causal relationship, but it's not randomized. So quasi-experimental is it's a trial, but it's not randomized, as opposed to an RCT, like a randomized controlled trial. A lot, for example, the quasi-experimental, it's just something that naturally there. For example, there's already a hospital disaster management plan in place in a particular, province or region within a country, for example, right? And then your research question could be whether is there a difference between the provinces or region that already have in place a hospital disaster management plan as opposed to those who have not. And then that's a quasi-experimental, because you cannot randomize which province or region that already have in place hospital management disaster plan, but you can only observe how they go about, in terms of patient safety or preparedness or whatever, because it's just how it's designed. And if it's randomized controlled trial, you would randomize the provinces or region. This one gets hospital disaster plan intervention, and this one do not, right? So that's randomized. But in real life, and especially in social science, including public health, we often cannot do a randomized controlled trial. So we relegate to quasi-experimental. The next one is the qualitative bit. And this is just an overview as well, right? Because we're not here to talk about the methods in itself. And I'm sure a lot of the audience in the room are quite familiar with the methods they're using and have already in mind papers that they will be like starting to write. But with the qualitative research, next slide. So qualitative research, what's interesting about it, it has open-ended questions, right? So it gives us a bit more perspective, and design could develop over time. It's a more interpretive approach, and a lot of fun ways to do qualitative research, actually, it's as opposed to the usual ones. Usual ones is like, oh, we're gonna do key informant interviews, we're gonna do FGD and all that. But now you can always try photo voice. You can apply other qualitative methods, maybe not ethnography, but there are a lot of exciting ways to do a case study, for example. And for areas where it's quite niche and quite new, like disaster management, a lot of case studies could actually bring about good insights and new perspective on different aspects in disaster management. Can everyone still my voice okay? Just checking.
Yes,
Yes, okay.
we hear you.
Next one. Thank you. Next one is the mixed method.
So now this one is getting more and more familiar and also quite often to be used because it gives you the good part, the good sides of both methods, right? You can analyze quants and then the qual speaks to it, or you can do a qual and then complement it with a quant and then further do the qualitative to further explore, right? So there's a sandwich approach. So qual, quant, qual, or a quant and then a qual. And that's just some of the combinations that we can try. But also, again, it depends on the research questions that you are trying to address, really, right? What do you want to know? Do you just want to know a description or a correlation between A and B, or do you also want to know the reasons behind it, the context that it plays, the factors that contributes in terms of more behavior or leadership style, organizational style that you cannot just capture in quantitative data. So you decide depending on your research question, but let's be pragmatic. It also depends on the type of data that you have, or the type of resources that you have. Do you have time and resources to do big surveys, for example, or you just have time and resources to the very specific but very targeted case study, for example, right? And and that's what we do as researchers. The next bit, we talk further about choosing methodology, right? So in addition to matching it with the research question, as I mentioned before, it's also, the type of questions can also be a bit more, you can think about it more. So quant research question, usually descriptive, comparative, relational, right? And then you can play with fancy statistical approaches to tease out particular, effect size of a particular variable, for example. But with a qual research question, usually it's theory based, it's more purposive, and it allows for in-depth observation. So it depends on what you're looking actually. In the next slide, kind of have this simple steps in choosing the methods. So first, you have to be comfortable with your research questions, your research. Oh, I'm hearing that echo again, sorry. And then assess the feasibility in answering that, right? So do you have the resources? Do you have the data? You have access to the data? Do you have the time to kind of observe changes, for example, or do you have resources to follow certain people or certain organization or certain health facility for a certain time of period? And then you go back to the literature and see, okay, what have people done in answering similar questions such as mine? What kind of the options, a range of options of methods that they have try to use or utilize, and then consider research ethics, of course, and then you fix with an appropriate methods. So these are the simplified steps in choosing research methods. But again, I draw a lot on past literatures to see what people have done traditionally, but also what people have done in a more creative way, right? If I'm interested in using a bit more fancy quantitative analysis approach, I would always consult previous literature, and then and at many stage in my career, I just try to emulate, I just try to learn from what they did by redoing it again, using my own data in my own setting, for example, until I'm super comfortable with that approach. Then, oh yeah, okay, now I know how to use this regression model, for example. And then I go about learning other methods, and that's pretty much how we learn, right? We don't try to what do you call it, it's not always rocket science. It could just be science, it doesn't have to be like a super duper complex and difficult. And also one of my PhD supervisors always say a good methods is the simplest one to answer the research question. Your paper, it's not gonna, it's not a better paper just because it uses overtly complicated methods. The good paper is the one that answers the research question. So as simply as possible, and that's my take on, choosing methods. And in the next slide, it's just a bit of, the gradients for purely qualitative, kind of mixed qualitative, and then purely mixed where the quantitative and qualitative has equal status, and then up to the purely quantitative where you don't collect qualitative information at all, right? So that's the mixed method, broadly speaking. And in the next slide, I just wanted to pose examples of research questions that I found honestly on the internet, and let you decide on what methods we can use to try to answer these kinds of research questions. Can you go to the next slide? That I procure off the internet related to disaster, preparedness or response or mitigation. So the first one, how effective are current disaster preparedness training programs in improving healthcare workers' readiness and response during disaster? Yeah, is it qual, is it quant, is it mix? Can we do a scoping review or any other methods that you think, we can try about, in answering this particular type of question? Any thoughts? Scoping review. Yep. Muhammad Reda, do you care to a bit more?
Your answer from the audience? No. No answer. Probably I will answer the scoping review as well.
Yeah,
Oh,
sure.
okay.
Well, Reda said scoping review or qualitative. Yep. Ken, any thoughts? Did you say you want to answer it?
Equation that you provide there, we can answer that, or only for the first research question?
Oh, I was talking about the first one. So we have
Still the
two
first one.
people saying qualitative. Sorry, it's just the how effective are current disaster preparedness training in improving healthcare workers' readiness and response, right? Qualitative. Interesting. Okay. Yeah. Any other take other than qualitative? I might have my bias because I'm more of a quantitative learner. You can do scoping review.
Qualified that we can access, Dr. Tiara?
Sorry?
If there's some numerical data that we can count, of course we also can do the quantitative research as well. in this topic?
Yeah, yeah. I would agree with that. It depends on what we have and how we define readiness, right? If we have readiness score, then it could be quantitative as well. This kind of question, and then it has been published before. It's actually quantitative analysis, you know. So they evaluate, you know, the training programs in particular settings. I forgot which one, but then they do a pre and post survey on the readiness score of the healthcare workers. So it's more on a like correlational analysis of quantitative data. But I also agree that definitely it has been published. A lot of scoping reviews and systematic literature reviews have been also published on this particular research question. So document review is always a go, especially when you're not really sure what's out there, right? Um, and then, oh, Madelina has answered all. Okay, scoping review, quantitative. Okay, that's very ambitious. Thank you. But on the first one, how effective? It's more on a quantitative and scoping review, especially if you have the data, for the quantitative bits, right? And then the second one, impact of early warning systems and health outcomes. I would agree with Madelina because this is a quantitative, you know, health outcomes. It's usually quantifiable, and it's a clear kind of variable that people would ask in their research question, right? The third one, what are the most effective mental health intervention for disaster survivors, and how do they vary across different types of disasters? Interesting. Any take other than it could be qualitative? Qualitative. Hafizat is agreeing with qualitative on the number 3. Yep. Is it because of the how do they vary across, or which which wording in the research question that would make people say this is a qualitative inquiry?
For me, it's more quantitative on the experimental.
Sorry, come again.
So more quantitative, but using like experimental method.
Uh, yes. I think one paper on this was a mixed method. So they would quantify the effectiveness of the intervention, but they would want to explore the contextual understanding through qualitative inquiry. So how it's vary across different type of disaster and population. It's a bit more qualitative one. Yeah, good response. And I would agree there are a lot of quantitative data might be able to answer this. Yeah, exactly. I agree with Abdul Hakim as well. And I think that's what they did in the paper. It's a lot of kind of personal kind of inquiry, um I think personal experiences and more of a deep dive into individual experience. So definitely yes. Okay. And the number 4, how do different resource allocation strategies during disaster response affect the quality of healthcare delivery and patient outcomes? There's one saying mix. This is for the number 4. How do different resource allocation strategies affects the quality of healthcare delivery and patient outcomes? Could be
Anyone answer
qualitative.
that as well?
Huh?
Besides Miss No, probably there are some others answers beside Miss Madelina?
Yeah, Sena is saying qualitative as well. So you can quantify resource allocation and you can quantify quality, but also you can do that qualitatively as well, right? So I would agree with Hafizati. It depends, right? So what variables do we have? What kind of data we have for the independent and dependent variables? Mm, Speaking strictly from a quantitative perspective, but also definitely mixed method as well, or a qualitative or purely qualitative one, because we cannot always quantify quality, even though most of patient outcomes are quantifiable, at least the ones that we use in public health or global health. Right, and the last one in this slide before we move on to referencing is what role does technology like health system, like telemedicine and all that. Oh, can we go to the previous slide? Not yet, the second. Yeah. Play in enhancing the effectiveness of disaster health management, particularly in remote or underserved area. And this also depends, I would say, if people have on the stage of its implementation. If it's just the start or it's a formative kind of inquiry, in terms of like, okay, we going to implement this, want to know we want to know what can us. It could be a qualitative kind of assessment, like a formative role kind of brings. And particularly if it's in remote or underserved area, which I think technology is also can take different shape in remote and underserved areas. Right. I'm kind of aware with the time, so I'm gonna skip the next slide, which has another set of research question. And I'm gonna let the participants play with that round. There are 6 questions in this, in the next slide that you can think about, what kind of data. It's not just deciding whether this is a mixed method, a quant, a qual, or scoping review or literature review, but more on, okay, what kind of data would I have or would I need to be able to answer this? And then what can I do with that kind of data? Whether it's quantitative in nature or qualitative in nature or mixed method, or do I have to combine it with further, case studies, FTEs or KII or whatever. Then and I don't think, and this didn't came from papers, so you could also steal some of these questions if you find it interesting enough or hasn't been like assessed in your particular context. Yeah. Oh, I think the number 5 have been published quite a lot. Anyway, so I'm gonna let you play with that, and then we can move on to the next slide on referencing. So referencing, we can have so many weeks and days just to talk about, proper referencing, how we go about searching and avoiding plagiarism. And there's a thing about in academic writing called voice, right? Voice is who really talks in that particular sentence. Is it someone you're citing, or is it your own voice? Is it your own opinion? Or it's a mix between the two. And I find some papers, and this again might not be relevant for the level of your research experience, and I apologize for that. But a lot of people, they cite too much, too often, and too much, that we don't really know which one is the original voice, the original opinion of the author itself, right? So that's a thing about, there are so many facets to good referencing, but I'm just gonna touch on the key ones. Next slide. So why do we reference, and I'm sure you know this, but I just wanted to iterate, right? It supports your argument, it gives validation, but also it shows that you are the expert in the fields because you know the key readings, the key publications relevant to the field you are, studying. And then it shows that, okay, I know this, I know people have done this. So when I say this is the research gap, I know what I'm saying, you know, because without reading enough, you cannot know what's not out there, right? And there's a what a rule of thumb as well, saying that if you haven't read at least 20, 30 papers, there's no way you can write a page of essay, like an academic essay, because you haven't read enough what's out there to know what is worthy to be written on your essay, for example, an essay or publications and all of that. So it's more often than not, just in the introduction section, people would have cited like 10, 15, 20 papers to show that, okay, this is what I know about the fields, showing that I know enough about the fields. And then they're supporting my argument that this is a gap in the research and this is what I'm going to do. And then a lot of the discussion section as well would be a lot of citing, because you would draw your findings and interpret them in a way that it's contextual. So you have to draw upon previous research in other contexts or similar settings that could support your findings and your interpretation of your findings, right? So referencing that one validates, supports your argument, convincing people that you're a good researcher, you're expert in the fields. And then, of course, we want to always avoid plagiarism and give credit to the original authors. And I think on plagiarism, when I was studying in medical school in Indonesia, this wasn't really stressed on, I would say. Like maybe it's just because I did my medical school so many years ago, but also when I was doing my master's in Australia, I find that they take plagiarism super, super seriously. They even fire professors because they self-plagiarize. So self-plagiarize is a different thing, right? They forgot to cite their own paper in their new paper. So that's auto plagiarism. So they self plagiarize and they still got fired because of that. That's how serious people take plagiarism issue in terms of academic writing. So and I find that that is respectful of the authors or the original researchers, but also again it validates your argument, right? I know these people have written this, I know the experts in the field have written this, so what I'm saying is makes sense, and you can also try to counter argue them, and that's how knowledge kind of grow, right? We say, oh yeah, you're right on this, but maybe not on this particular side, and that's valid as well. And that's, we don't have to agree with everyone. That's exactly how we develop our knowledge. And the next slide, and this might relate to the previous question as well, right? We have different sources that we can consider. It's not always journal articles, it's not always just this ones in the list, but it could be like newspaper articles as well. Blogs now are getting more popular. Um, yeah, newsletter, and from news outlets as well, especially with the new you know new issues that aren't super evidence based in terms of it's not well researched yet. And these are, common thing to do, especially with sensitive new issues. Just a few, maybe 1.5 decades ago, that issues on gender-based violence is not well documented, and you can only find those kind of issues from newspapers or other media outlets, right? And then people start to research it, people start to use the gender perspective framework kind of to unbuckle or uncouple and just unlock the phenomena, trying to understand the determinants a bit more and all that. But it all starts with what's happening in the society. And I think us as academics, you know, should also, go back down to earth and see what's really happening in the community instead of just what's happening in journal articles, which sometimes is so far away from reality. We don't know that it's far away from reality as well, right? I just wanted to remind myself of that as well. Sometimes we write things that as no, it's not relevant to the real world. It's not relevant to real people. Maybe it's relevant to our peers and our ratings in academic worlds, but not always, right? And that's also why case study, personal experience, especially during COVID and after that as well, it becomes more and more relevant because those are the things that are relatable to people and you can reference that as well. And in the next slide, where are we? So searching for references. I'm not gonna go too into detail on this, and I'm sure a lot of you would already know as well. I I love using database Google Scholar to be mindful about it because it's one of the most generic ones. It includes different languages as well. And if you know any database that is specific to the language that you preferred, for example, you want to study something in Tagalog, maybe there's a database that would include a lot of the national or internal publication. So in Indonesia, we have that type of database where it just procures a lot of really rich Indonesian publication that would otherwise are not available in PubMed, in JSTOR, in Web of Science or ASI, right? And so try to use something that is quite broad that would capture your field of science. And I'm saying this also because a lot of public health issue, including disaster management, is actually interrelated with other disciplines as well. So sometimes they don't just fall under a specific academic database, and you might miss a lot of them because maybe it falls under health management. It's not disaster, or it falls under mental health, and you won't find it in a specific asset management database if there's any, right? And on the next slide, sorry, I'm kind of rushing because the next slide is particularly important. Whatever database you're using, these are the things you need to consider when you're reading an article, right? So it's not just where it's published. Of course, that's important. So if it's a Predator journal, it has no, credible editorial board, for example. Maybe don't read it because usually crap journals are for crap publications in general, right? But the other things that you need to consider as well, even in a well established or reputable journals, are the authority. So author credentials, their affiliations, are they experts in their fields? Are they doing work related or relevant to the things they're researching? Or whether they, for example, they're an engineer doing research in pharmaceutical just because they want to, which is like it's a questionable authority. And then accuracy. So you have to also check the data that they use, the supporting evidence that they use to support their argument, for example, and of course their relevance to your topic. And then the currency, right? Like I said, we have to know what's out there, what's the most current, what's already outdated. Maybe there are seminal papers that are still relevant, and then we have to know that as well. And then, is there any biases? Is it someone from a pharmaceutical company doing research on a drug that they're promoting, right? So those are the kind of things that we always have to check before we go about reading citing them, using them as our supporting arguments and all that. I'm gonna stop here because
Information.
you
Yes,
can share.
we just have 4 minutes more
Yeah.
for today's session. Yes.
Yeah, so I'm just gonna well, you can have the slides, and it's just about citation and avoiding plagiarism, where you can see different levels of plagiarism. And then yeah, if there's any question,
From
just
Yumi
check.
Makiko.
Yumi Makiko, thank you.
Yes.
Question: using national law, global guidebook, gray report.
Global
Yes,
Guidebook.
totally okay. Totally okay. And if you check, the different referencing style like Harvard, APA, Vancouver, depending on which this particular journal is using, there are certain types of, referencing styles that you can use if you want to cite national law, global guidebook, or any other like gray publication. And that's totally okay. Yes. How scientific accuracy level? Well, it depends on what you're using them for, right? If it's your citing data, maybe that's super relevant. A lot of these publications actually publish, national assessment on disaster preparedness, for example. And yeah, so it depends on how you use this. I hope that's okay. Yumi?
Yes. Probably that one is the last question for today's session. So once again, I remind everyone to fill out the attendance form. So we will have your data, your information. So in order to, if you need some kind of the like today lecture presentation, we could send you through your email. Okay, I think yes. Okay, thank you again, Dr. Tiara. That very insightful presentation, and we learned a lot from you. And also thank you everyone for your engaging questions and active participation. So once again, special thanks to Dr. Tiara for sharing your expertise and providing us with those valuable insight. So I would like to conclude, but I think I will just quoting from Dr. Tiara presentation because we have very limited time. So once again, a good research is one with worthy to answer question. So we already know the method to write the effective introductions, and then also how to choose the correct methodology, even though like Dr. Tiara say that start with the research question, not the methodology. So I hope that today's session will be very informative to us and will assist us for our research. And stay tuned for our upcoming meeting in the next academic writing workshop that we will hold the academic writing workshop third meeting in June 7. Yes, okay. So thank you everyone. Have a great day and stay safe.